Governor, your first question is going to be from the audience, from this nice lady right here.
Hi, nice lady.
Hello, nice, nice sir. Hello, my name is Holly Schweitz. America and Iowa's low single-digit unemployment rate are well known. But for people with disabilities, the employment rate is a mere 19.1%. My son is a 2010 graduate of the Iowa School for the Deaf here in Council Bluffs. Vocational rehabilitation services is woefully underfunded with waiting lists for that program and developmental disability services. There are limited opportunities for training for people with disabilities to engage them in work experiences and encourage independence rather than dependence on public assistance. What kind of plan do you have to increase services and programs for people with disabilities, young and old, in relation to employment and training?
Yeah, and thank you so much for the question. And I sure hope you're proud of your son and all of his accomplishments. And it is one of the things that I guess I'll put it in two different ways. One of which is what's happened at the state level and what happens at the federal level. Because when you look at everything from the privatization of Medicaid here, or you look at what often you're funding on the state side, that has so many of the impacts on both your son and everyone else. And I think that's one of the challenges all the way along, is that I see that as a governor. Like, I can tell you things that I've done for individuals with disabilities and our Voc Rehab program in Montana. And recognizing like a sub-minimum wage for individuals with disabilities doesn't make a heck of a lot of sense along when what work provides dignity and opportunity along the way. Funding Voc Rehab programs, recognizing the importance and removing barriers in each of our communities for greater employment, and recognizing also that an individual with disabilities is going to be able or have different challenges going to the workforce, and you can't just meld them all together. There was a guy named Jack Markell who was the governor of Delaware, and I'm currently National Governors Association chair. When he was chair, though, he put together an overall work plan of here are what governors can do and ought to be doing to make sure that if you really want to have full employment and if you really want to have full opportunities, what we need to also be doing is including the disabled. I think that leadership often happens at the state level, but it's incentivized at the federal level as well. And as the next president, I do everything I can to both partner with the states and provide the funding, because work provides dignity and opportunity, and I think every workplace, every inclusive workplace, actually all the employees are that much better off as well.
Okay, Governor, you've said that there are any number of paths to make health care more affordable, but you're supporting adding a public option to the Affordable Care Act. Why is that the right path?
Yeah, and I'd also say that I'm an AARP member. I suppose there's a few of us there. But I also probably bring a different perspective in some respects than most of the people on this stage, because before I got into public office, I was a lawyer for AARP Montana. And mostly I worked on affordable energy issues, but it underscored to me something that all of this matters, right? I mean, nobody should have to choose between paying their heating bill and buying their food or paying for the prescription drugs. When I look at healthcare, directly to your question, Kathy, we ought to all be able to agree that, look, we're the only industrialized nation in the world that doesn't have access and affordable health care. And we can get to accessibility and affordability. And what I would do is certainly first, like in Montana, even with a 60% Republican legislature, we expanded Medicaid, providing 100,000 Montanans quality health care. I think that the best is to do more or less a Medicare or a public option for anybody that wants it. The ability to buy in from the federal government. And at the same time then, that will cause some push and pressure along the way for price competition. I would also turn around and say, and I have done a lot on outside spending, dark money in our elections. We pay more for prescription drugs and healthcare than any country in the world, and we have nothing to show for it, and the prescription drug companies are doing pretty damn well. and working to get rid of both surprise medical billing and out-of-network charges. You could do that at the federal level. Start transforming the overall payment models. But I don't think that the best way to do it would be to get rid of 80% or 70%, 180 million people that have employer-sponsored health care. So many of them like it. Sometimes you don't like either the costs or the deductibles. We could work on that without disrupting the entire system and starting anew, from my perspective.
Senator Sanders was just out here and said that the primary goal of private insurance companies is to make money and not to provide health care. Are you leaving people with what it would be less than what we would consider to be universal health care if so much of it continues to be covered by the private sector?
Well, look, 25 million folks about don't have any health coverage at all. If you expanded Medicaid in all these states, that'd cover about 15 million. Now we're down to about 10 million. The question becomes affordability on an exchange, from my perspective. By having a public option, you're going to be able to make it more affordable along the way. I think that we also just have to look at, as we get there, and what's interesting, and a guy named Mo Udall, who ran for president a long time ago, he said, when Democrats organize a firing squad, we usually do it in a circle. I mean, we're real good at tearing apart one another. And here we are at a time, 2.5 years in this administration, where they're trying to rip health care away from every single person, completely dismantle the Affordable Care Act. And not only does that go to that base health care, but when you talk about keeping Medicare alive or the donut in drug costs, that's part of that as well. So I think that while there's differences in approach, I just don't think the best way to get to the point of universal is disrupt 70% of the people. We can control costs and we can increase accessibility without throwing everything that we've done and starting over. And I guess I'd also add, too, that I think I bring a little bit different perspective than folks from Washington, D.C. When I'm hearing about health care, it's when I take my son to Target and somebody walks up to me and says, here are my challenges. As a governor, you're right on the front line each and every day of the challenges. And so many times, I think in Washington, D.C., and this isn't necessarily talking about Senator Sanders, but it's just a general, we put out these plans that go no further than a press release. And talking at times has become the replacement for doing. I don't have that luxury in my job. And I think as we talk about all these plans, we also have to say, how are we going to attain them? How are we going to pay for them? And then how are we actually going to provide that much greater opportunities in a time where it still may be a divided, whether we like it or not, a divided Washington, D.C. politically? I think we can do a lot more than what we're doing now.
Governor, you will be on the debate stage.
Yeah, oh, shoot, will I? I had no idea, Kay. What the heck happened?
During the last debate, the candidates were asked if undocumented immigrants should be covered by government-paid health care, and people raised their hands. What would you have done?
Yeah, thanks for the question. First, so I wasn't on the first debate stage. I got in apparently a little late, only about 7 weeks ago, notwithstanding, like you go back to when Bill Clinton was running. He didn't even announce until October the year before. But I couldn't get in earlier. My legislature was meeting. It meets 90 days every 2 years. Got out the day before yours in Iowa did, or 2 days before. I had to get Medicaid expansion reauthorized. We tried to do it by ballot initiative. Tobacco companies spent $26 million killing it. So I had to stay there and actually get that because 10% of my population relied on that. And I'll tell you the truth, if it ever came to chasing 100,000 donors or getting 100,000 people health care, that's the easiest decision I could ever make. But I am going to be on the next debate stage, and I think that not just in that question, but in many other areas, that it seemed like some of the debate within the Democratic Party is detached from individuals' everyday lives. I mean, when I meet a teacher here in Iowa that says, you know what, I had to take a second job just to pay for my insulin payments. Or there's a county or a local city councilor who turned around and said, my son had a surgery on his hand. He got his hand caught in a door, didn't quite get it all fixed, cost us a lot of money. We're now going to have to get a second surgery. And when the decision is fixing my car or paying the money to get my kid's hand fixed, an easy, easy decision. Look, I think we need comprehensive immigration reform. That's where I would begin on this. And I think that there are steps, I don't know if there's going to be any questions on that, we can talk about it. But my approach on that, and we've got to figure out for the about 8 million undocumented immigrants living in this country, 2/3 of them have been here for a decade. We got to work on immigration reform to get them to a path to citizenship. But like overall health coverage for folks, I would not provide.
Shifting to social,
Well,
sorry.
before he goes on, isn't that a humanitarian issue, though? You know, we have people in this country, a lot of them are paying taxes, they're doing work, and
some are buying
because they're
insurance,
yeah, so they're not on a path to citizenship, but we would deny them health care coverage.
Yeah, and I'm not talking about like ER room, but it's a humanitarian crisis, right? That teacher who's invested with the most important things that at least I have as a father is working a second job. It's a humanitarian crisis that local city councilor has to make those decisions. And I think one of the things though, in this, look, the biggest problem right now with immigration policy in the United States is who we've elected president. He is dividing our... He's ripping apart families, he's ripping apart communities, he's ripping apart this country. There are things when you look at the separation at the border, that was by his choice. That wasn't required. This is a humanitarian issue, but there are many, many steps we can take. I mean, I think Democrats believe in border security. We don't believe in an 18th century solution, this wall, to a 21st century problem. We don't agree in cutting off aid to the Central American countries, which is down 2/3 in the last 5 years. And we do believe in, if you know no other country than this, the Dreamers, their protections were ripped away by this president, or a path to citizenship for the other 8 to 11 million. We ought to be able to figure that out.
Let's shift to Social Security.
Let's do.
This past year, you vetoed a bill that would have exempted the first $30,000 an individual gets in Social Security income from Montana state income taxes. As president, what would you do to taxation for retirement savings?
Yeah, and generally, like, right, Social Security, what an amazing program. If you look at 35% of our seniors back in 1959 were living in poverty when it first came in. Now it's less than 9%. Now that's still 9% too many. And it's a program that not only has provided economic dignity, but it reflects our overall moral values. That people as they age ought to be able to live with dignity and respect. The specific bill that you reference, I mean, I have this legislature that loves to come to me and say, here are all these tax cuts, but never wants to raise revenues. And we're kind of in the same position in Washington, D.C., where, look, I don't think we should be raising taxes and everything, but the Republican Party, and the way it's been co-opted by the outside spending money, can't even say they're going to be doing fee increases. So any time that I'm going to provide a cut, I actually have to figure out the revenue, because Washington, D.C. hasn't fully passed a budget in 22 years. If I did that in 1 year and it wasn't balanced, I'd be kicked out of office.
Let's just tick-tock through a few social. Would you raise the retirement age, yes or no?
Would I? No, I would not.
Will you get rid of the cap on taxation?
Are you doing these TikToks on me?
Well, I'm just trying to.
Raise your hand at least.
Oh, thank you.
Would you raise?
Put a foot out on me? No. Would I raise the cap on? I think when we look at overall solvency of the Social Security system, the idea that those that earn more pay a little bit more, yeah, I think I would have to take a look at this, because there's also folks that have paid into this all their lives, and we got to make sure that they get the benefits out of it.
2 years ago, you had to balance your budget after oil and gas revenues tanked in your state, and you had to cut you proposed a budget that cut $27 million from senior services and long-term care. If you're the president and facing the need for budget cuts, What do you do when you face senior services, things like the Older Americans Act, for example, that
Yeah.
has lots of opportunity for in-home care for seniors?
Yeah, so we had a little bit more going on than that, too. We had an inflated revenue estimate, and it said, walked out of legislative session and said, we're never going to get this money, so the legislature kind of put in, here are the places that you'd cap or cut, or you'd have to cut this amount of money. We had a record fire season, most expensive fire season in my state's history. And that's something that you can't just say, oh, I'm not going to pay for that, as communities are literally burning and we're losing the lives of firefighters. And you look at it as state budget, you know, about roughly 80% of the dollars go into educating, medicating, and incarcerating, right? Those are the three areas that your state budget. Federal government has defense, but the vast majority of expenditures go to. So did have to make some difficult cost-saving measures that impacted people's lives because my legislature also wouldn't raise revenues along the way. So my priorities, though, is, you know, the federal government, and that's another one of those examples where it's the federal-state partnership. Our challenges of providing continuing services in some respects in long-term care areas was because the state wouldn't put in the money to match. I think the federal government has to continue to be the partner that actually pays the most, and you shouldn't be balancing budgets on the backs of seniors or anyone else.
Several Western states have either legalized marijuana for medical or recreational use. You signed some changes in Montana's program this year. As president, how would you prosecute marijuana policy at the federal level?
So yeah, and this is just, well, I guess I was going to say my opinion, but yes, it's my opinion, or it wouldn't be up here. I mean, I don't think the federal government should be prosecuting marijuana policy. I mean, I think that this should be left up to the states. Medical marijuana has been for Montana, and we've gone through the evolution of this program since I was Attorney General before I was governor. And it goes to individuals in need, and it makes a meaningful difference. But you always have the barriers at the federal level, both the scheduling of it as a drug and the difficulty of banking any of the dollars being medical or recreational. So I think the federal government should get out of the way, and this is a state-by-state decision.
Turning to more traditional medicine, you're on the record as not favoring reimportation of prescription drugs from places like Canada. Why not?
Well, I think that there's a couple of different things that, you know, first of all, you often hear, well, the prescription drug companies say, well, you know, we do all this research and development, so it's not fair to get them from other countries. They spend more on advertising right now than they do on research and development. Reimportation is not my first, I guess my first priority, or what I'd like to do first to try to get drug costs under control. It is, to me, a sign of both the toxic influence of money in our elections and how broken Washington, D.C. is when the biggest purchaser of prescription drugs, the federal government, can't negotiate drug prices. This is just insanity. So goal number one for me would be to lift that and be able to negotiate for a fair price. If that doesn't work, if we don't get to the point where prescription drugs are a heck of a lot more affordable, because just like I was saying at the start, when I was doing energy issues, literally had people talking to me, seniors, AARP members saying, I have to choose between heating my home and picking up my prescription drugs. Nobody should have to make that choice. If you can't get to that point, then I think there are things to look at from importation from other countries and possibilities of indexing and things. But the first ought to be that we ought to be able to just negotiate for a fair price. Not trying to say that prescription drug companies have to give away all their drugs, not make any money, not invest in research, but if you're spending more on advertising than you are on your research, you shouldn't be getting a tax credit for that. Shouldn't be able to write that off. And then you ought to be able to, just like in every other area. I mean, We negotiate for the cost, or at least we can get several different options if we want to get our car fixed. We ought to be able to get the ability to negotiate when it comes to prescription drugs.
What should the regulation be, if any additional, on the reverse mortgage industry?
So the regulation on reverse mortgage industry, and this is when I was Attorney General before Governor, was part of as these banks took people apart, not just on the reverse mortgage side. I mean, the level of financial fraud in some respects and what it did to people's lives. And then we took all our settlement money and tried to get people back into homes and figure out ways to look at it. And I think that to a certain degree, and it's not unlike, like we banned payday lending in Montana. Like the idea, right, that somebody, and there comes a point where people are preying on those in financial need because they know that those in financial need literally have nowhere else to turn to. And I think that reverse mortgages can be much the same. And from that perspective, what we've even seen in this last 2.5 years, part of not only when we were going after the banks, but we put together the Consumer Finance Protection Bureau and to say, let's crack down on the abusive practices. And what we're seeing time and time again under this administration is they're trying to dismantle the Consumer Finance Protection Bureau. So I think that part of it really just does look at what are the abusive practices. I don't have a specific 19-point plan, but it's one of these where it makes pretty well common sense, where if you're ripping off somebody and they're paying usurious rates and they're not even going to be able to stay in their home along the way, it's probably not what we as Americans should accept.
One of the reasons that seniors seek out financial help in the form of these reverse mortgages or other ways of doing that is they can't pay for their long-term care.
Yeah.
It could cost $100,000. Long-term care, the idea was originally incorporated into the Affordable Care Act, but it turned out to be unaffordable. Yep. So how does your plan deal with the cost of long-term care?
Yeah. And I look at this, we hear about these big abstract policy stuff. I kind of view it through, we'll call it Bill and Rosie. Bill and Rosie were my grandparents, and Bill was a tire salesman, Grandpa Bill, all his life. And he did pretty well. They retired, they did well, and they were living in the Smoky Mountains, Franklin, North Carolina. Rosie got dementia. Bill had never done the books, and he was the most trusting guy in the world. There I was in Montana having to try to get a power of attorney because Bill was giving away his money to darn near everyone, and he wasn't giving it away, he was getting scammed out of it. So I had to take control of Grandpa Bill's checkbook. Talk about taking away dignity. And then we got to the point, because Grandma Rosie was in a long-term care facility, where between what he lost by the scammers and what that was paying, they'd spent their whole life working so damn hard, and things got more and more difficult. And where it ended up, though, is even before, is Bill had to say, all right, now I have to exhaust all my money. Because that's the only way he would live in dignity when he got older, is Medicaid would pay for Bill's long-term care at the end of that. And we're paying $154 billion a year through Medicaid for long-term care. It doesn't make sense when we know that 2/3 of the folks, I won't ask if you're over 65, but are going to need that long-term care. So I think that, and we've been looking at something where you could add a supplemental program to Medicare that'd be like, the price out like $35 or $40 a month. And that'd be like an insurance along the way for those that wanted to pay into it. And then that would cover long-term care. I think that's probably one of the best ways to do it. Another thing, though, then we also have to look at, that often, especially in rural areas, the long-term care facilities are hooked on the hospitals, and we have about 20% of our hospitals at risk of closing, rural hospitals in this country. And so we've got to be investing in, and it's often Medicaid expansion and other things, keeping those rural hospitals viable to keep the long-term care facilities viable as well.
Governor, thanks for answering our questions. We'll give you 30 seconds to wrap
That's
up.
all?
Yeah,
I thought we were just
sorry.
getting going. No, hey, first I so appreciate you all taking a little bit of time, listening to what I have to say. I'm 7 weeks in, this is, I think, my 7th trip to Iowa. And so appreciate also what I'll call Iowa nice. So I meet people, they say, yeah, you're on my list. Well, is your list 37 or is it 4? What I'd ask of you is, I think I bring a different perspective. It's a perspective from a rural area like many of you are. Perspective from outside Washington, D.C. Perspective of actually having to work and make government work at a time where government is so divided. So I would be remiss if I didn't wrap up first by thanking my former employer, AARP, that was on the Montana side, but thanking you all for taking some time out of Saturday afternoon when you could be doing anything else, and asking you also to keep a close look, even in this field of 37 or whatever it is, on what I'm saying and what I'm doing, because I believe that I can make both the economy start working again for working folks and also our political system. And most important, probably, I think this dangerous time in this 240-year experiment called representative democracy. And we've got to figure out a way that we're handing off something to that next generation better than what we got. So thanks for having me, Kathy. Thanks for having me, Kat. Thank you. Thanks.